Um, my background is in social work. I got my bachelor's of social work in 2005 and then my master's in 2013. I have past experience doing case management services and then some grief work and emergency department social work at a local hospital, which was the bulk of my master's degree experience up until when I started doing outpatient therapy a few years ago.
Oh, so you've seen it all.
Yeah.
If you've been in the hospital setting, that's you must have a heart for really helping people when they're having difficult times. Okay.
Yeah.
I'm going to repeat what I said. Sorry to our guests. I'm Dr. Maureen O'Keefe, a pelvic health and TM joint physical therapist at Purple Mountain Physical Therapy in Grand Rapids, Michigan. And I have invited speakers from our local community to share resources with you because some of these services that they offer are things that my patients over the years have benefited from. And EMDR is one of those things. I've been referring patients to go to EMDR therapists. Definitely for 10 years. I found proof of that in my email box today, but it's longer than that. And I have found with my patients that if they can see a highly qualified counselor to treat their anxiety, depression, or trauma, while they're getting physical therapy, for some patients, it can accelerate their results. So previously, I brought a counselor here in February who spoke about particular treatments for anxiety and depression. That was an awesome talk with Anya Nyson, a counselor here in Grand Rapids. And you can watch that talk or any of the talks we've had on the Purple Mountain PT YouTube website. Now tonight we're speaking specifically to EMDR. So I did not know that Ashley had worked at an emergency room and now has pivoted the last number of years to private practice. And she has a team of providers that really do serve our community. At this point, you prefer and have focused on helping women in particular, correct?
Yeah, for myself, each therapist in our practice has their own focus area. But for myself personally, I primarily work with women going through life transitions. I do a lot of work with women who are postpartum. Birth trauma is something I see a lot of.
Awesome. Yeah. So we're going to get into it. Can you begin by just telling us what is EMDR? I find my patients have never heard of it, and because it is somewhat newer. I believe that this therapy first emerged in the early 2000s, this therapeutic method. So what is it?
Yeah, so EMDR stands for eye movement desensitization and reprocessing, which is a mouthful. But one piece, it was actually developed in the late 1980s. The first study released on it was in 1989, but still a very new therapy in therapy standards compared to some other treatment models out there. So EMDR is a therapy approach that really allows a person to reprocess past experiences that they haven't fully processed. Their brain hasn't adapted it in a way that is beneficial and helpful. Instead, the memory, the event has gotten stuck for them in a way that shows up oftentimes as trauma. So EMDR, kind of in a nutshell, helps to open up those memory networks to activate the memory network and let us reprocess those past events that are bothersome for us currently, even if they happened a long time ago.
So eye movement, desensitization, and reprocessing. So we're talking about eye movement happening in a counseling session. And one of the reasons why I found this to be really fascinating, and I'm interested to learn from you, is because in physical therapy, we are often talking about the mind-body connection, that if you are experiencing chronic pain, that pain that you might have in your pelvis or in your jaw is happening into your spinal cord and into your brain also, and your brain is deciding that you're experiencing pain. So we are very in tune in our physical therapy world that we need to include the whole nervous system in our treatment, which is part of the reason why we include some neuro down training and heart rate variability training in our care. Can you talk to what this eye movement looks like? I've had patients describe it to me. But what does that look like? Why is the movement, because eyes have muscles, why is the movement of the eyes helping them tap into a stuck memory?
Yeah. So eye movement, through research, it's been found that eye movement or any form really of bilateral stimulation of back and forth movement with the body can help with the reprocessing piece. So it doesn't have to be eye movement, though that's the recommended use for that bilateral stimulation. The thing with the EMDR is we don't know how it works. We know it works. There's a wide body of research that tells us it works, but the exact brain process of how what we do makes it work is still pretty unknown. So I don't know that I can directly answer that question of how the eye movement is activating the memory network system. But again, it's been found that having that back and forth motion does help to activate
in there. We know in physical therapy for our TM joint patients, they always have upper neck problems. So we're treating the upper neck. One way that we get you to activate your neck muscles is with eye movement activation. It's really interesting. And you guys might be able to feel it if you can touch the top of your neck and work on your eyes. You might be able to feel change and tension in your neck. And then another thing we do is a lot of crossing midline with the body because you're changing in the brain, the corpus callosum. Anyhow, so I have no idea how it works. It sounds like you're saying that there's emerging research as to how it works. I know we talked before we got on here that you had found that there was a meta-analysis of 25 randomized controlled trials on this. So there's been many randomized controlled trials, which is the gold standard on using EMDR. And these 25 trials that were used in found in the meta-analysis did find that this EMDR can be a beneficial way of processing trauma.
Right. Yes. Yes. A lot of, like I said, a lot of extensive research on it. When I did my training for EMDR in 2019, the trainer that I had told us that there's been over 40 randomized controlled studies at that time in 2019 on EMDR. Backing up a little bit, or kind of along the lines still with the research, the one thing that's really being explored or that's theorized about the eye movement piece is that it replicates REM sleep. REM sleep.
Oh, interesting.
So we know that when we sleep, when we dream, that's one way that our brain is processing events and emotions, can help us to store that information adaptively. So the kind of overarching theory about the eye movement is that we're replicating that sleep cycle.
Oh, that's interesting.
Yeah.
It's The Power of Sleep. That was a really good book where it talked about how in sleep your brain is like cleaning things up and maybe you're helping that. Interesting.
So the way eye movement or bilateral stimulation is applied can either be by the therapist using their hand and waving back and forth, and you track with your eyes that movement. There are light bars that some therapists use where there's a light that you track that's moving back and forth. The tool that I use, I have handheld buzzers where you hold a buzzer in each hand and they actually vibrate back and forth, giving a tactile bilateral stimulation, but those also have lights on them that blink back and forth. So you could track with your eyes as well.
So they're holding this and they have to look at it without moving their head. You have to look at it.
They can look at it if they want. They can close their eyes because they're getting that bilateral from the vibration and the buzzers.
Oh, so they can have their eyes closed and they don't have to do the eye movement. You're giving it to them this way.
Yeah. And the fascinating piece is, well, one, a lot of people I find when they're recalling past information or past memories naturally close their eyes. So having the tactile stimulation is nice for that. But people still move their eyes. I can see when they're reprocessing the eye movement under their eyelids.
Mhm.
So even if they're not tracking the lights, the
Yes.
eye movement
Yeah.
still occurs.
Yeah. One of my earliest patients who told me about EMDR, this was probably 2010 or something. She was with her counselor, she had to watch a computer screen, and there were things to watch on the screen.
Mhm.
Now, can you say who is EMDR for? That is a question that, like,
Mhm.
what's the type of person or the issues that may benefit from this?
Yeah, EMDR originally the research around it originally was around post-traumatic stress disorder. A lot of the early research was with veterans with PTSD. So if you Google EMDR, a lot of what pops up is trauma, but it's been proven to be effective with depression, anxiety, eating disorders, grief, really any mental health need you can think of. It's been shown that it can be effective with it. Specific phobias is another one I commonly get inquiries about. So pretty
Awesome.
much anyone really could utilize EMDR. It's safe for children, teens, adults. The areas where we want to use more caution comes to like medical. If someone has a seizure history or epilepsy, cardiac issues, like a high risk pregnancy, EMDR has been shown to be safe to use in pregnancy, but a high risk pregnancy, those different pieces, we would want to have the medical doctor sign off that they feel they're okay to
Mhm.
manage EMDR.
Mhm.
And then if someone has eye problems, it can cause eye strain, and we want to make sure that we're not going to mess anything up there. Because again, even with the tactile stimulation, that eye movement still happens back and forth. And if you're moving your eyes back and forth for an hour, that's a lot of work. So really those medical pieces. The other areas we want to be cautious about is if someone has a history of dissociation. So where they experience disconnecting from themselves. So a lot of times dissociation can look like or feel like you're on the outside looking in. You're not really experiencing what's happening. You're more of a witness than a participant. And we want to be careful that people don't dissociate during the EMDR process. So if someone is high risk for that, there might be other work that we need to do first before utilizing EMDR.
In physical therapy, we run into that also, the dissociation, because some of our patients have had trauma or harbor tension, or the body kind of wants to protect down in the pelvic floor. So if I'm working on your pelvic floor and that is an area where you may have experienced any abuse, or you may be holding some stuff, the dissociation can potentially be happening. So we here at Purple Mountain, we are aware of that, and we work very closely with people to make sure that they are with us the whole time and participating in a safe environment that is appropriate for what their mind can handle.
Yeah.
Okay, so you said that EMDR could be used across all ages for men and women. You called out that a lot of the original research was PTSD, but anybody who's experienced, it sounds like, a wide variety of mental health issues could potentially benefit from this. Can you talk about the phobias? Are you treating phobias often?
Yeah, I'll have people come in, not super often. A lot of what I work with tends to be birth related trauma and sexual trauma. But I've worked with people as well where it's depression or anxiety, and then some specific phobias. So like if you're flying or fear of driving, even being able to target those fears, where do they come from, and being able to resolve that fear so that they can overcome that phobia.
Okay. Now, can you talk about the birth trauma? Because I've had
Mhm.
patients who really quite a bit benefited that. In preparation for this, I was looking up some of the research, and I did find research to support the use of EMDR for women who are pregnant and have fear of childbirth.
Yeah.
So it can help you get yourself ready to your child's birthday and be more whole, less anxious, I imagine.
Mhm.
But if you experience birth trauma, and a lot of times in my world, I'm working with people who have, or even just birth disappointment, maybe
Mhm. Yeah.
it's a powerful experience that we go through, and it might not unfold the way you had expected, and that could be very upsetting to us. So
Mhm.
EMDR might be one therapeutic technique to try to help you process through your birth
Mhm.
and get you ready for the rest of your life or having
Yeah.
more children, right? So talk
Yeah.
to us about that.
So, EMDR, I'm gonna go in a roundabout way to get to that.
Great.
EMDR first, it's a very structured therapy. There is a protocol, step-by-step protocol that we follow with the EMDR process. There's 8 basic phases that we go through. So the first phase is history taking, which you're going to get in any type of therapy. That first appointment, that intake appointment, the therapist is getting your history, finding out why are you there, and working on coming up with a treatment plan. After that is preparation, making sure the person understands what EMDR, that they can give informed consent to do this type of treatment, and making sure that they have the resources that they need, the internal resources, the coping techniques to be able to manage EMDR and any hard stuff that might come up in it. Again, we don't want people to dissociate or to feel flooded or so overwhelmed that they shut down. So that preparation phase is really making sure that the person is well equipped to go through the reprocessing part of EMDR. After that, we move into identifying a target. So in EMDR, we pick a target memory. That's kind of the cornerstone for the reprocessing phase. So if someone comes in with birth trauma, we're going to talk about that birth trauma, but we're going to narrow it down to a specific target. So one way to do that is to talk through it and identify with them what was the worst part of that birthing experience, what image represents that. And that's going to be our touchstone point, where when we start reprocessing, we're going to start out with that image and process from there. Sometimes if a person has prior experiences that are linked to that birth trauma, so birth trauma, it's not uncommon if they've had a previous trauma or even just a really negative experience in the medical field, that could be influencing the experience they had and why they have a trauma response now. So we might not even start with the birth itself. We might be going back to that previous experience that they had with a past medical event. So working our way forward. Once we have that image, though, once we identify that target, there's a series of questions that we ask about it. And these are our rating questions. They serve multiple purposes. One is to help track where we are in reprocessing. How do we know when a target has been complete or fully processed? Also, the questions are asked in a certain order to start activating that memory network, activating both hemispheres of the brain to set us up for that actual reprocessing. So once we go through, we have the image, we go through the different questions, then we start the desensitization phase, which is either the eye movement or the tactile bilateral stimulation, whatever the therapist is using. And the unique thing about EMDR is there's not a lot of talking. It's very much an internal process. So if we've pinpointed a birth experience, a traumatic birth experience, and we've narrowed down, what that image is to represent it, I'll prompt the person to notice that image, to just focus on that image. And I'll turn on the buzzers that I use, and I run them for about 30 seconds to a minute, depending on the person, what they can tolerate. And then I'll pause them and I'll ask them what's coming up or what did you notice? And that check-in is designed to be very brief for them to either say, I'm feeling a lot of anger, or I'm noticing the doctor's voice, or I'm good, keep going. The check-in isn't to do any verbal processing in that moment. It's to make sure the person is still with me, that they're still grounded, that they're still here and present, they're not getting flooded, they're not dissociating. So then I'll say, okay, notice that, run the buzzers again. And then we keep going through that process, letting them go through that memory network. It's kind of like a free association of the brain. So a lot of different things might come up. Some people will go through the event in the order it happened. Others will bounce around. Some people will be like, oh, something from like 10 years ago just came up. I don't understand why. And the thing is, our memory networks are so interconnected that if something comes up that feels unrelated to that target, I'll prompt them to just notice that. And in doing so, seeing if that is connected. And sometimes they'll realize like, oh, okay, this is coming up because this is what has kind of laid that foundation for the response you've had to this. And we'll decide together, do we switch the target to that experience, or do we stay with where we're at? So the reprocessing it can bring up a whole lot of stuff. It can bring up things the person never expected, or sometimes it can flow much how they would expect it to. Again, like replaying the event as it happened. Through this reprocessing, the disturbance level of that memory, how bothersome it is when they come in, will go down. Sometimes it goes up first, especially if it's a really big trauma. But it'll reduce. And our goal is to get it so that it's no longer bothersome for them. So after we get through the reprocessing phase, we want to install the positives. We're working towards a positive outcome, an adaptive belief. So if someone comes in following a birth trauma saying, you know, I'm not strong enough, or I'm not a good mom, or whatever negative belief they might hold as a result of that experience, we also have a positive we're working towards, which might be, I am strong, or I did survive it, or I am a good mom. Like that experience doesn't define who I am. And so we want to install that positive cognition to help really build in that adaptive memory network for them. After we install that positive belief, then we do a body scan. We do bring the body in quite a bit because our bodies hold our memories. And so we'll do a body scan. And if anything negative is coming up in that scan, if I tell them, okay, picture that image, that target image we started with, what do you notice in your body? They're like, oh, my chest is really tight all of a sudden, or I'm having pelvic pain, which is really common with birth trauma and sexual trauma. Then we'll notice that and do more of that reprocessing to try to clear that out. At the end of every session, we close it by doing some stabilizing exercises to make sure that the person's good when they leave the office, that they're able to go on with their day and still function well. And then if we're not able to get to fully process a target in one session, then the next session we do a reassessment. So we check back in on that target. We go through our different rating scales again and to see where it's at and continue from there. I know that's a whole lot of information I just threw at you.
Really helpful. So she just took you through what a typical EMDR appointment would include. And I like what you said. I did not know in the beginning you have prescriptive questions to ask in a certain order to try to identify if somebody is ready and able to face this, and to try to determine what it is that this person needs to be processing through. I've had many patients who tell me that they were talking and processing through unexpected things at their EMDR sessions, and that they always tell that to me with a real big positive, that they didn't know that they were still upset about being cut from the 7th grade basketball team and all of their friends made it.
Yeah.
These things are inside our body. It's amazing how
Mhm.
our brain remembers things that we have forgotten, but they will come out in a session for you.
Yeah.
And you are doing this. It's really important that when you're getting your therapy, you are working with someone who's highly qualified to make sure that you are doing this A, in an effective way, and B, in a way that's safe for you. You don't just unlock trauma and let
Right.
this all go. So you mentioned that this therapeutic process of EMDR really brings them back to a place of, you called it positive. And
Mhm.
I heard that. I think it's also kind of affirming and maybe
Mhm.
reframing. If you think this was
Yeah.
the worst thing that ever happened to you, maybe we can reframe that and understand that
Mhm.
differently, or
Right.
that's especially helpful for people to, especially with birth. I find for the people that I'm working with, sometimes they're afraid to have another child because the first
Mhm.
experience was quite different than they expected. And if we can get help from someone like Ashley, then maybe they will feel more able to face another pregnancy if that's
Yeah.
right for their family.
Yeah. And part of the installation phase um, is to, so EMDR is they call it a three-pronged approach. So we focus first on the past, and then we're going to look at the present. After we've been reprocessing, we're going to look at the present and see, okay, how's this showing up now? A lot of times that's where people will tell me that different triggers they've had or reminders of the difficult event, they're not experiencing that anymore. They're not getting activated anymore. Relationships are improving, or they're doing things that they were never able to do before. And then we look at the future.
Mhm.
So we'll identify. So with sticking with the birth trauma, it might be like, okay, now let's have you imagine that you are having another pregnancy, and let's imagine, maybe imagine your ideal birthing experience. And we'll play through that, and we'll notice, does anything come up? Is there anything that stands out to you where you get stuck, where you're like, oh no, like that's not going to happen? If there is, we process that more to make sure we have all the pieces cleaned up. And I will typically do several different scenarios, because in reality, the ideal birth experience, I don't know if that exists for anybody. Maybe a few lucky people, but it almost never goes according to plan. So we might process through and imagine perfect experience, and imagine, like, okay, what's your biggest worry of what could go wrong? Let's imagine that happening, but you handling it well. Like, how would you want to handle that? How do you want to come through that? And being able to imagine themselves going through that potentially difficult experience again, but not having that trauma response.
Mhm.
So that's where that more adaptive or that
Mhm.
positive outcome comes in, being able
Yeah.
to generalize it in that way.
I had a patient explain what you just talked about.
Mhm.
It really, like, beautifully. She said, we've sort of worked through my EMDR and my trauma is good. Now I'm going to have a few more sessions and we are going to, she called it future cast. We're going to future
Mhm.
cast to help me move forward and think about my life in the future and how I
Yeah,
will manage experiences.
yeah,
It's very empowering.
it is.
That's awesome.
It is.
Okay, we had some other questions. One question was, somebody submitted and they said, should healthy people do EMDR? So,
Yeah. So a healthy person, if you identify as being a healthy person, I'm not 100% sure what the definition of healthy person is in this context. But if you're someone who, say, doesn't really have a trauma experience, you don't have depression, you don't have anxiety or another diagnosable mental health condition, but maybe you have something that keeps coming up for you, something that makes you worry more than you should, or a memory that keeps surfacing, that you're like, I don't know why this thing bothers me. I don't feel like it should. Certainly EMDR could be very
helpful.
appropriate to address that.
Okay. So I suppose what I'm hearing you say is that if you're healthy and you have really no conditions, no mental health issues, then maybe you
Mhm.
don't need that. But if you are writing this question because there's something that is coming up for you and you're like, could I work on that?
Mhm.
Possibly.
Yeah.
Yeah. The next question that was asked was generally, how long does it take for EMDR to work?
And that there's not a straightforward answer to that one. A lot of the research tends to use an 8-week time frame, studying research participants for 8 weeks. And for single trauma event, so if you've had a great upbringing, you're healthy, right? And now you've had one negative, difficult experience, one trauma that happened, and that's our only focus is that trauma. Research often shows that within 3 sessions, the symptoms can drastically reduce or completely resolve it. Now, that's dependent on a lot of factors, though. It's dependent on how well resourced you are at the beginning of our journey together. If we need to spend a couple sessions building up coping strategies, then it's going to take longer. An hour-long session doesn't give us a ton of reprocessing time. It's generally recommended that EMDR sessions are closer to 90 minutes. We have, unfortunately, a lot of constraints with insurance if we're using insurance for how much time we can spend. But a lot of research supports that within 3 sessions for a single trauma event. But again, just to emphasize, it can, and I find it often does, take more than that. For someone who has multiple traumas, especially if it's developmental trauma through childhood, if there's someone who was raised in a household where there wasn't strong attachment bonds or there was frequent abuse or neglect, and their traumas stem from that developmental history, that's going to take a much, much longer time. I don't really have a time frame to give for that. Just because, again, there are so many factors that play in there. Oftentimes, in that case, we're spending a lot of time, sometimes months even, building up those resources. And sometimes we move back and forth between the stages of EMDR. We might start reprocessing. Then the next time someone comes in, they might say, that's too much for me last time. I can't do that today. So we either focus again on those resources or we'll process things verbally. So that, it could be a few weeks, a few months. For some people, it can still be a years-long process. It just depends on what all we have going on that we're trying to work through.
In my experience with what patients have told me, you are going to an EMDR therapist while you are getting your cognitive behavior or other method usually, or the EMDR therapist is that. I guess what I'm saying is that EMDR, what patients are telling me, can be a finite experience where you work through it and it can complement the other therapies that you might also be doing, right?
Yeah, I have some people I work with who are referred by a therapist they currently see for cognitive behavioral therapy or another therapy model, and they're seeing me just for the EMDR while still continuing with their other therapist. Other times I have people that I work with that we start out with cognitive behavioral therapy and then move into EMDR, and again, we might move in and out of that in between the different modalities depending on where they are and what they need. Others will come in and I'm the only person they're seeing and we're only doing EMDR.
Okay.
So variety of options.
There was a question. Somebody asked, what if you don't know what your trauma is?
Yeah, that happens a lot.
Yeah.
And again, with EMDR not requiring a lot of talking, we don't need to know what your trauma is specifically. If you know that there's a trauma, or you know that every time you drive by a certain street, your chest tightens and you get really nervous and anxious, if that's the only thing we can go off of that. We don't need to have all that history. I haven't had this experience, but the person I did my training with and other therapists that I know have had experiences where they've worked with someone where the therapist has no idea what they're processing, where the person will come in and say, I have this trauma, I want to process it, I don't want to talk about it, I don't want to tell you what it is. So as long as they can get like a keyword for that target image, the therapist doesn't technically have to know what it is you're processing for it to be effective. The not knowing piece, I have had the experience of someone who had a trauma. She knew that something had happened. She didn't know the details of it. She didn't have the cognitive memory of it, but a lot of physical sensations, a lot of hypervigilance, a lot of trauma symptoms. And we were able to process through and resolve it, focusing almost exclusively on the body symptoms, on the physical complaints that she experienced.
Now, somebody asked, does EMDR uncover hidden or suppressed trauma? So is it uncovering things?
So yes and no. A lot of this, it's hard to give like a direct yes or no answer to. There's a lot of controversy out there about if repressed memories are a thing or not. So I'll say that first. But the one thing EMDR is doing, because as you're processing, it can bring up other memories for you that maybe you had forgotten about, different experiences you forgot had happened. And I guess it depends, you could look at that as an unearthing repressed memories. The phrasing that I have found that resonates the most for me is that when we're processing a target, that can activate other experiences that have been stored, what we call maladaptively. So they haven't been stored, fully processed in a healthy way. So by processing one target, we activate those other memories and experiences, and we've made room for those to come up. We now have the space in our mind for those to be available for us to be aware of and to deal with.
That makes sense. Another question was, how do you find an EMDR therapist that addresses, it says the patient side of treatment, or maybe they mean PT side of treatment? I'm not sure what the question is exactly, but I suppose, let's say it's PT. So in our physical therapy, we are working with people often who have chronic pelvic pain, chronic back pain, chronic TM joint pain, neck pain, or bladder problems, or intimacy problems. So your question here is how to find an EMDR therapist that can also address those sorts of things.
Yeah, so again, through identifying whatever the target is, we can process those physical symptoms that are coming up. We could collaborate if needed. So if you're treating someone and you've referred them to me and I'm working with them, if that person has given permission, you and I could collaborate and discuss like what you're seeing coming up, what I'm seeing coming up, and are those two linked in some way? It's possible if it's related to a trauma experience that as we process, you're going to see an improvement in their physical symptoms as you're working with them.
I do.
And also
I do see that.
You working with the body can help release some of that stored
It does.
trauma, which can, have effects in the therapy room too.
Yeah.
So if we're talking about PT, I think the two do kind of go hand in hand if we're working on the same thing contributing to that physical ailment.
Mm-hmm.
If we're talking about the patient side, because the question said the PT side of treatment.
How to find an EMDR therapist that addresses the patient side of treatment, if that's what they meant. We're not sure what you meant.
Yeah.
But
so if it's that, I would just say EMDR is very collaborative with the patient or the client. It's a team approach, and really more than anything, you're the one who is in charge. So again, if I'm working with someone and they come in one day and say, I don't want to reprocess today, it feels like too much, then we don't reprocess. Or if we start reprocessing and we're 2 minutes in and they say, no, I don't want to do this, like I'm done for the day, then we're done for the day.
Mm-hmm.
We can change directions at any point in time.
Mm-hmm.
It's the most important thing for me is that whoever I'm working with feel safe to be able to go through and revisit those difficult experiences and process it. Because if you come in and you're not feeling safe, if you feel like you can't process whatever might come up, then we're not going to get much resolve.
Mhm.
So working together collaboratively with the patient or client really being the one in the driver's seat.
Great. Okay, next question. Is somebody was asking about ETF is what they wrote, but we thought it was emotional freedom technique or
Or emotionally focused therapy.
so these are two different therapy methods, emotional freedom technique or emotional focused therapy. And the person who submitted the question, all they wrote was ETF. So we're not really sure what you wanted to know, but Ashley.
Yeah. So if it is emotional freedom technique or emotional focus therapy, I'm not trained in either of those modalities. The little bit I know is that emotionally focused therapy is used commonly in couples or with families, addresses emotions as being like the prominent factor for your mental health and functioning. So a heavy focus around emotions and emotional response. That's my understanding of it. The other one, emotional freedom. Thank you. I blinked on that technique that uses tapping. So tapping on like acupressure or meridian points. So like under your eyes would be a spot. And again, I'm not trained in that modality, so I don't know much beyond that either. They both are evidence-based treatments, which means they've had enough research behind them to support that they're scientifically based, that they've been proven to be effective.
A person asked, is it possible to completely clear trauma from the body?
Yeah, and I'm glad you sent that question to me ahead of time because I've actually been thinking through that one quite a bit. I'm going to say yes. And that's based primarily on my experience. The reason I say it with a little bit of hesitancy is part of it is going to be, I think, on your own perception. So trauma, as we work through and process our traumas and we're clearing it out of our bodies, we're reprocessing that event, we're storing it in a way that's adaptive and helpful for us, we're eliminating that trauma. The thing with the way our brains work is our memory networks, again, they store all of our experiences, and resolving trauma doesn't get rid of that memory. That memory is still there. It's just no longer disruptive for us. But with that, our brain is building from that experience. Our brain is going to remember like, hey, this thing happened. It was bad. It felt like a threat. We didn't like it. And so if something similar happens again, that memory network is going to again get activated. And the brain's going to be like, oh, hey, this happened before. It wasn't good, right? Then it has to decide how to respond. Does it respond with fight, flight, freeze, survival, which is where, you know, what breeds a trauma response? Or it might be able to say, this happened before. It wasn't good. Oh, but also we were able to work through it and realize that it's something we can survive. So this is a very stressful incident, but we're not going to have a trauma response with it, if that makes sense. So you could still have, if one of your trauma responses is a racing heart or tight chest or shortness of breath, right? Some of those physical symptoms. If you're faced with a highly stressful incident, you still might have those same symptoms, those same feelings. It doesn't mean that that's a trauma response necessarily.
Okay.
So I hope that answers the question.
That does answer it. That's really quite helpful. So what you said is that it may be possible to fully clear trauma from the body. However, if you are exposed to a similar circumstance or something, maybe the brain remembers to go back to its original pattern, or possibly you've reorganized and your response to that is different.
Yeah.
I also sometimes think maybe we hold on to our trauma, even though we've completed EMDR and that may have been beneficial. Maybe we're holding on to our trauma because it's part of our identity. And if we actually give up that identity that I am the person who survived the car accident, if that's a really closely linked to your identity, it may be harder for you to fully get rid of that. Is that the case
Yeah,
or no?
so that actually can come up. It does come up a lot in EMDR and can be something that blocks the processing of it. If someone is saying like, I don't know who I am without this, and they don't want to let go of that trauma, we're not going to be able to fully process that traumatic event. So we're going to have to work through that piece of like, okay, who are you with this not being traumatic?
Yeah.
You still had the car accident, you still survived it, but does it have to be a trauma response for you? Or can it be, I was in this really bad car accident and I survived it, but it happened and it's in the past
Yeah.
and it doesn't define
Yeah.
who I am.
That's what I think is part of the hallmark of a good counselor. Anya Nyson at the talk in February, she talked about how she teaches people skills. The goal is to really try to get us to be able to move forward from holding on to these old patterns, whether it's with EMDR or other things. And
Right.
so if we're talking about clearing trauma, maybe if you want to fully clear it, maybe the EMDR is able to do that. But also, Ashley already mentioned that she uses cognitive behavioral therapy and other methods to also get you skills to be able to even experience EMDR. Somebody else asked a question about microdosing psilocybin, which is a medical mushroom. Can you comment on that?
So again, not an area I have experience with. That's not in my wheelhouse. I do know that psychedelic treatment for mental health is becoming more popular, I guess. I'm getting a lot of flyers about trainings for it. I'm hearing of other people who are exploring it and researching it. So I think, that's something that's being researched right now, being explored as a possible option for treating mental health. But I don't personally have any experience, haven't done any trainings or research in that.
Okay. There was a question that was physical therapy focused. It said, I've been told my pelvic floor is overactive. I'd love some more information on how to get it working flexibly again. Thank you, is what they wrote. So thanks for submitting that. If we're talking specifically about high tone pelvic floor, the physical therapy that we do works to try to retrain those muscles to get them to have full range of motion. The muscles sit at the base of your pelvis and they need to be able to lengthen and they need to be able to contract. And what you're describing with an overactive pelvic floor is that they have sort of adaptively come up into the shortened position and they don't really move. They have a lot of stiffness in there. And there's a lot of things that can contribute to that, a ton of it, which is why we are assessing somebody kind of head to toe in physical therapy. So I can't say exactly what you need to do specifically, but general things that have been found in the literature that we see in our patients. There tend to be weakness or dysfunction of your glutes and your hips. And that causes the pelvic floor muscles to be adaptively responding and overtaking some of the role that the hips should have been doing. There tend to be postural changes, especially in this postpartum population, where we have the ribs will flare up and out, the back is in too much of an arch, the pelvis is tilted, and it places the pelvic floor in a position where it's not able to function optimally. So addressing all of your connective tissue and your strength and muscle imbalances to improve your posture helps. There can also be a tendency to be sucking in your abdomen, even the tiniest little bit, like we don't want that muffin top, the tiniest little bit of like, oh, I'm going to tighten up my abs a little bit all day long to stand up tall. That is not effective because the abdominal wall should actually be relaxed until you need it. And you don't need it like that all day long. And the pelvic floor muscles respond to the abdominal wall. So if the abdominal wall is coming in with a little contraction, the pelvic floor muscles are going to go into that overactivity that you're describing. Those are three things. There's many more. There's pelvic organ prolapse, and there's things like C-section scar adhesions, endometriosis things. For men, we deal with people who have testicular pain, and that can contribute to perineal upregulation. There's a whole bunch of things. Generally, we do check people's hip range of motion and give them a variety of stretches and fascial movements, maybe yoga poses, to open up the hips and calm down some of the overactivity of the pelvic floor. And we also find that working on your breath work, getting the diaphragm to be able to work effectively, can help your pelvic floor to start responding to that breath, because the two work hand in hand. And so if you're not breathing with your diaphragm, your pelvic floor isn't getting this little bit of movement all day long, which makes it more stiff. Also, back to our original topic of the EMDR, the pelvic floor muscles have autonomic nervous system, like fight or flight. They have that built into those muscles, which makes them really unique muscles in our body. We don't have fight or flight nerves in our bicep, but we have some of that controlling our bladder, our bowel, and some inputs of that into your pelvic floor. So this fight or flight that we're talking about with trauma or anxiety or depression, stuck things mentally can cause the pelvic floor to react that way. So we do find working with a counselor can help with this pelvic floor high tone, and working on down training and regulating your own fight or flight response. So in physical therapy, we do a variety of things to tap into your vagus nerve, which is your rest and digest portion of your nervous system. We want more vagus nerve and we want less sympathetic nervous system, and that can help ease your pelvic floor. So breathing exercises are one way of tapping into it. We teach certain massage techniques along the neck and the head that can tap into your vagus nerve. We have a bunch of different ways of doing that. Okay, my last question for you, back to EMDR focus. Somebody said that this was their submission. I thought it was a great question. They said, I have looked up EMDR providers in the past, and I was confused on who to get training and certifications in this skill. I believe I saw psychologists, counselors, social workers, etc., who all are claiming to offer EMDR. And it was hard for me to choose someone to see. So how do you find, is it true that anybody can go and get this training? How do you find someone who's appropriate for you or for your friend or family member, or if I'm referring a patient?
Yeah, that is a really great question. So anyone who is a trained mental health professional, so all the professions listed in that question, psychologists, marriage and family therapists, social workers, we can all get trained in EMDR. EMDR is regulated. There is a process of going through it. There are two levels of it. There's what's called basic training, which is a 6-day training process. And then you have to do 10 hours of consultation or supervision. And then you submit information to an organization called EMDRIA, EMDRIA. So it's the EMDR International Association. And they're the overseeing body for EMDR treatment. And so you submit your information to them saying, hey, I did the training, met the criteria. Then you get a certificate, showing that you've completed that training. To do that, you have to either be a grad student in one of those mental health professions, graduate student, near the end of your schooling, like a first-year grad student wouldn't qualify. And then there's extra paperwork that they need to get signed off to be able to do the basic training, or a limited license or your full license. So you have to get approval. You have to meet certain criteria to do the basic training. Someone who goes on to get certification, they have to do 12 hours of continuing education credits in EMDR, so advanced EMDR treatment modalities. They have to be fully licensed. You have to do 20 hours of consultation, and you have to submit proof that you have done 50 hours of EMDR with clients. You have to say at least 25 clients. You have to total at least 50 hours, and you need letters of recommendations from peers. So it's a pretty big process to go through to get that certification. And then that has to be renewed every 2 years. So how to know if someone is qualified? The first question I would ask is if they have done an EMDR approved training. So again, that EMDR IA training. Because there are trainings out there, they're more informational, right? So you could go and do a 1-hour training or even a 1-day training about EMDR that's teaching you this is what EMDR is, but it's not teaching you or preparing you for how to actually implement it. So you want to be cautious to not have someone who's like, oh yeah, I watched a video on that, I can do EMDR. That is not what you want. So EMDRIA on their website, it's emdria.org. They do have a list, they have a directory of therapists. The caveat with that is it's a paid directory. So not everyone who would be qualified is on there. I personally am not on there. I haven't paid to have my name listed. But you can go on there, and the website is a wealth of information. There's access on there to all sorts of research. You can see what the criteria is for EMDR training to be qualified to utilize this treatment modality. There's general descriptions of what EMDR is, just a plethora of information on their website.
Awesome. So go to that website. I would also say, to answer this question, I found in trying to identify counselors in our community that might be able to support my patients, I found counselors have particular niche areas of interest. Ashley likes working with women. She has employees who work with different ages. Some people like working with anxiety. Other people like working with eating disorders. Some people really like working with teens. I think if you're trying to find someone who does EMDR, I would go to the EMDR IA website, and then I would also probably just make a bunch of phone calls and really ask probing questions. Who are they commonly working with? What is their area of interest? What is their background? So that you can find, just based on a phone call, that maybe this would be a place for you to begin scheduling an appointment or not. When potential patients call our clinic in physical therapy, we answer all of their questions. We want to find out if we think we can help you, and we want you to understand what we might be able to offer. It's very different than, and I think in your small business, it's probably similar. It's very different than just calling up a random hospital and getting assigned randomly to see the cardiologist, and you don't know the background of that cardiologist. In our fields, you want to have somebody who really is able to work closely with you. So in physical therapy and in counseling, you can often call a small business and get a lot of answers from the person answering the phone. We need to wrap up in a couple minutes, but you did bring some books that are great resources. So can you show what you brought and just very briefly give your recommendations?
So a really great book to give just a simple overview of EMDR, and it also walks through some exercises that you could do yourself without a therapist, is Getting Past Your Past by Francine Shapiro, and she's actually the person who developed EMDR. So that's again pretty easy read, general overview of EMDR. The Body Keeps the Score by Bessel van der Kolk is kind of a staple book in the therapy and body treatment worlds. It's focused on trauma and how the body stores trauma. There's a chapter in there about EMDR, and where he cites some different research that he's been a part of. It is a heavy read. So I do like to let people know that if you're going to read it, like, it's a commitment. So it is a heavier read, but a lot of really good information. And then the book, What Happened to You by Dr. Bruce Perry and Oprah Winfrey. This is a newer book. I think it was released earlier this year, but it gives a very simplified overview of trauma what trauma is, how it shows up, how we respond to it. The thing I love about this book is it is an easy read. If you do audiobooks, Dr. Bruce Perry and Oprah Winfrey narrate it, which is nice, but it's written conversationally. So you have like, I don't know, that can be seen, the black ink, I think it's Dr. Perry, and blue is Oprah. So it's written conversationally, which makes it easier to follow along with. And then there are some different images too to help describe what they're talking about. But this is a very easy, simple,
approachable book.
Yes.
Oh,
Yes. I highly recommend that too, to give a better understanding of trauma.
well, thank you for bringing resources and for
Yeah.
sharing this information. I've really wanted to talk more in depth about what EMDR is, because as I said, my patients have been the ones who have pointed me in the direction of this being a helpful and useful therapy for over 10 years. So Ashley, can you tell everybody how they can find you and where, what more, a little bit more about your business?
Sure. So we do have our website. It's balancedlifegr.com. And on there's information about the services we provide, about each therapist in our practice and what their specialties are. There's a contact form in there, which makes it really easy to get in touch with us. And we can give a quick response that way. You can always call our office. Our calls do route to an answering service just because we're generally in session, and instead of having you get a voicemail, I'd rather have you leave a message with a real person, but they would forward the message to us and we can follow up that way. We do also have a Facebook and Instagram page, and the hand, is that what you call it, the handle? I'm not super techie. And that's just Balanced Life GR on Facebook and Instagram.
Awesome.
Yeah.
Okay, well, I really want to thank Ashley for coming. I'm Dr. Maureen O'Keefe, a pelvic health and TM joint physical therapist with Purple Mountain Physical Therapy in Grand Rapids, and many of my patients benefit from counseling. So we brought Ashley here and previously Anya Nysen to talk about their treatment approaches. We also have additional speakers scheduled for the rest of the year. So you can follow me on Instagram. I'm very active at Purple Mountain PT, or on Facebook, Purple Mountain Physical Therapy. If you're interested in more information about our physical therapy, we offer care in person here in Grand Rapids or remote consultations for anyone who qualifies. I've been doing this now for 25 years, and I have a team of physical therapists, all who specialize in pelvic health, bladder, bowel, and TMJ, neck and back problems. So you can feel free to call our office at 616-516-4334, where you will speak with one of our staff members who can answer all of your questions. Or we also offer the online submission where you can ask us a question. And our business website is purplemountainpt.com. Thank you all for all of your awesome questions. I really appreciated that. You helped the conversation flow, and for watching and staying with us. Best wishes to everybody. Peace.